animal health specialist. I'm not an agricultural economist, I'm a health economist. So I rely on a lot of the data and a lot of the information from people who are specialists in that. And my job is to sort of listen and then put it all together. We worked with this model originally we were supposed to work in 6 countries that you see here: Egypt, Ethiopia, Uganda, Kenya, Nigeria, and Burkina Faso. But for various reasons, Egypt and Nigeria, we didn't get very far, so they dropped out. So we basically tested the model and worked with groups in 3 East African countries and Burkina Faso. So, how can a country address these challenges that will arise from intensive growth and intensification of livestock? How can we understand the nature and size of the threats? Know what policy and program options are? How can you respond to these issues? And organize, as is the case with One Health, because this is a One Health model, a multi-sector response. And one approach to that, not the only one, but because we're working at this high level of abstraction, is what I call policy modeling, which can help support strategies that balance the need for increased livestock as a source of food and export revenues and livelihoods with the need to protect public health, animal health, and the environment. So, I'm not sure how many people are familiar with what a model is, but basically, when I think of models, I think of them basically as a sort of as a laboratory in which you can think about the way the world is going to change, think about how you might change the way the world's changing, and see the results. And because we're projecting over 40, 50 years, we don't have to wait 40 or 50 years to see whether what we do in terms of a policy change or an intervention will have an impact. So it's a way of, again, of organizing your thoughts, thinking about the world, and coming up with alternatives. To me, that's a better way than everybody having their own little mental model, and they're talking like this, but nobody knows exactly what the assumptions are of the other people or the person that you're dialoguing with. So at least the model, and you might think, well, why did you have this assumption, or what? I don't like that parameter or that number. At least it's there, and we can talk about it. We can argue about it. You know, we can change it. Anything that's on the computer here can be changed in terms of a number. And don't get too fixated about the numbers. Don't be too specific about the numbers. The numbers are important. Any computer can generate data and numbers with 20 decimal points. I don't care about the 20 decimal points. I don't care about even one. I'm looking for, if we do this, does this go up a little, or does it go down a lot, or does it not change at all? So, skip that one. So these are some of the questions, not all of them, but some of the questions that this, what we're calling the One Health policy model, the one which you're going to learn about today, can address. For example, what is the expected burden of zoonotic disease among animals and humans if there is business as usual, if we just continue what we've been doing for the last 10, 15 years? What are the environmental effects of rapid livestock growth and intensification on the country? How will zoonotic disease burden in animals and humans change if the country undertakes certain interventions to control zoonotic diseases? What are the impacts of zoonotic disease on livelihoods? What's the impact on the agricultural economy, or particularly the livestock economy? And finally, what are the costs particularly in terms of healthcare as well as others, as a result of animal and human disease outbreaks under different investment or development strategies. And that's when we talk to policymakers, and there's a lot of work here and a lot of talking here about One Health and how important it is, and everybody here believes in it. But if you're talking to a policymaker, particularly in your countries, and you come in and say, you know, we've got a problem here with brucellosis or avian influenza, and he's worried about malaria or HIV or TB or how to vaccinate children, you got to have some argument as to why it's important. And one of the things that really gets people's attention is the money. How much is it costing? So this model has some of that in it. It's pretty basic and elementary, but it's a start. It gets you thinking about it. So let's talk a little bit more now about the model. This is a schematic diagram of the model. And basically, it's very similar to the one that I talked about before, the paradigm. We've got human population projections and livestock population projections. Those are linked because as the human population grows and as the economy grows, they're going to want more food. And they're going to want more food from animals. So those two work together. The larger the animal population, the more the potential impact is on the environment. We've already talked about the fact that the larger the animal population is, the higher the risk is for disease outbreak. And that has two effects. One is on the livelihoods of the farmers and maybe the country as a whole. And the other is public health, basically the impact of the zoonosis on human health. And that's something that is this idea of linking dynamically animal and human health at the macro level, at the level of the entire country, is relatively new. There are a lot of epidemiological models that talk about it. I just saw a poster about monkeypox in Nigeria, I think it was, and he had this epidemiological curve there in terms of number of weeks of exposure to the diseased animal. We're not talking at that level. We're talking here at the country as a whole or the region as a whole, depending on how we implement that. So the point of a policy model is not just to sort of scare you and say, oh my God, what's happening here? Where, the country's going to get worse and worse. It's also to provide some way in which you can try to change the future. And there are a couple of ways to do that. One is by some of the underlying assumptions. For example, one of the underlying assumptions is the rate of growth of the human population. And if human population growth can be changed, which you can through family planning programs and other things like that, that will filter through in the model. But there are also interventions in terms of, at the health level, in terms of zoonotic disease transmission, which I'll talk about in a minute, that are important. And that's where the policy model comes in. Because we've built into the policy model the possibility of interventions that will allow you to sort of bend the curve, as it were, of what might come in the future. So the model is actually simple at one level and complex at another. It's totally open. It works in Excel. It can be applied to any country. And when you set it up, and I'll show you this in a minute, you specify what are the animal populations you're looking at, you want to model, Is it dairy cattle? Is it beef cattle? Is it poultry? Is it, we didn't get very far, but we were going to do camels at one point as well. What are the human populations at risk of contracting a zoonotic disease from a diseased animal? And not everybody will be exposed or be at risk of getting a zoonotic disease because zoonotic diseases are transmittable from animal to human. There has to be some kind of contact. And we'll talk about that as well. So there are subpopulations of humans that are at higher risk than others. For example, the farmers themselves are at high risk. You can contract brucellosis if you're a farmer from a diseased cow, if you're helping that cow give birth to a calf. Workers in slaughterhouses and abattoirs, or markets, if they're selling fresh meat, may be exposed also to the pathogens that promote zoonotic diseases. And then humans themselves. And basically most of the not humans themselves, they're all humans, but the consumers of animal products, basically somebody eating infected milk from a cow who has bovine TB or something like that. So we specify in the model what are those populations that we're interested in putting into it. We also, of course, have to decide what the disease is. The model allows 2 diseases per animal population, and if you want more, then you have to sort of replicate the model in a different file. Production system is also important, and that's been found to be very important in terms of the way in which and the risks of zoonotic disease transmission. So if you have a pastoral system where the animals are spread out, free range, or if you have one set of risks, but if the animals are in a feedlot, like they tend to be in the States, the US, that's another set of risks. So there's a whole sort of range of levels of intensification. And that's another thing that you need to, when you set up the model, that you want to define in terms of what are the levels, what are the kinds of production systems that you're going to deal with, and then we'll show you, you'll see that it takes account of the distribution of the animals across it. And then in some cases, although we didn't actually wind up modeling this, the geographic ecological zone. So I talked about interventions, or sort of how to change the future through the eyes of the model. And these are some of the parameters, some of the data that you can change. And by the way, all of this PowerPoint, you will get a copy of it. I only have 25 flash drives, so the people in the front who signed up have priority over those, and then the rest of you can fight over it or whatever. But anyway, you can change any of these rates here. You can change the human population growth rate, the animal population growth rate, the intensification rate of production, that's the production systems. And then you can look at different interventions that affect animal prevalence, the animal-human interface, spillover, which is the tendency of the disease to go from animals to humans. Or another way to look at it is the probability that if you have contact with a diseased animal, whether you're going to, how contagious is the animal? Are you going to immediately contract the zoonotic disease? You may not. Amplification, I don't know how familiar you are with that. That's the tendency for a disease, particularly on the human side, to be transmitted from human to human. And some genetic diseases are transmittable from human to human, and some of them aren't. And then the other one is the case fatality rate for humans, and there are other parameters as well, but these are sort of the main ones. And what do we get out of this? We project by year the number of cases of the zoonotic disease that you're looking at in the animal population that you're looking at, the number of cases in humans, the number of animals who might die or are culled, the mortality of the humans, if it's a fatal disease, which a lot of zoonotic diseases are not. DALYs, I don't know if you're familiar with the concept of disability adjusted life years. It's a way of looking at the burden of a disease if you get sick. The healthcare costs of human cases, the economic loss from everything, greenhouse gas emissions through enteric emissions, and the water footprint. So when we started this project, we were working a little bit with the Ministry of Livestock and Fisheries, I think it was, in Ethiopia, and we noticed that they had very ambitious targets in their 5-year plan for the animal populations, different animal populations. So that reinforced that idea that there was going to be, at least in the case of Ethiopia, potential issues. They were looking at particularly 5 priority zoonotic diseases: rabies, anthrax, brucellosis, leptospirosis, and echinococosis, whatever. We are going to concentrate on brucellosis. It's a disease that is pretty prevalent in around the world, and particularly in East Africa. They were predicting, this is again from a literature review by ILRI. They were predicting 21 million cases of brucellosis in East Africa alone, and of course Ethiopia is in East Africa. The base year, the number of humans, human population, the human population growth rate, the prevalence rate among humans in the beginning year, basic reproduction ratio, which is sort of amplification, and then the distribution of the animals across 2 production systems, pastoral and intensive, with different growth rates. And then we simulated 2 scenarios for brucellosis, and that's the other thing about models, is you can concoct these scenarios, these sort of alternative futures, simply by manipulating the data. So one was business as usual or no change. The other was introducing these vaccination programs for cattle or animal hygiene or food inspection and so forth. This is a couple of outputs of this early version of the model. This is probably a lot different now that we've perfected the model. But basically, this is the number of infected animals with brucellosis from the base year in 2015 up to 2025. That's only a 10-year period. The red one should say basin. The red one is the The blue one is business as usual, and the red one is I believe, the scenario where there's more growth and intensification. We see also effects on the number of human population and the human population prevalence rate. And these are different here because of those interventions that I talked about. And then this is showing the economic loss in the livestock sector due to disease as a percentage of, I think it's a percentage of GDP. These are dollies, and these are the water footprints and the greenhouse gas emissions footprints. And again, you can see that it's quite significant. It starts in 10 years, it goes from 6% of the available water. In one scenario, it goes up to 8%, and the other scenario, it goes up to 12%. And if you project that out for 20 or 30 more years, those curves continue to go up. Yeah, this is the water footprint of the animals. In the two scenarios, it goes from very small, 1.3, up to 8 or 9% of total available water. And you can change it to the greenhouse gas emissions. And you get different figures here as well. It starts at 24%, and it goes up to 40% in the case of the long-term plan. We can also look at the effect on humans. So I'm just going to look at this one here because there's so many other graphs we can look at, but this is the graph of the number of infected humans under the two scenarios. And you can see that in the long-term plan, there are always more humans than that are infected than in the case of the business as usual. This is brucellosis. We can look at bovine TB, or we can look at both of them together. Bovine TB is, the parameters are quite a bit different than in brucellosis. So, I think the rest of this has got to do with dollies and stuff. So that's a sort of rapid tour of the model. Let me go back, and I talked about interventions. And this is the fun part of the model, in a way. And let me see if I can explain this, because it's so I talked about a model as a way of a laboratory for designing scenarios, and we saw two scenarios that we designed already in terms of the distribution of the animals across production systems, the animal growth rates, and so forth. Those are two of the biggest parameters that differentiated the business as usual in the long-term plan. And we got some results there. What if we can bend some of those curves? What if we can change what's going on there by some interventions? And I talked about these very vague interventions like prevention and one called detection and response. And you can make them more specific as you would. So we have, and there's several different categories of ways that we can go in here. The first panel here we're looking at here is intervention areas that have to do with animal prevalence in the 4 production systems. And the bars here represent the the level of those interventions, whether it's a vaccination program or which would be a prevention program or some kind of detection and response program. So these bars go from, I think, 1 to 5. We've got the long-term plan already jacked up to 5 across the board, or maybe not 5, but maybe 4. Actually, if I look at it, I can tell you. Oh, it's 5. Yeah, they're all 5, except these 2 are 4. So basically, you can change these. Supposing that in the business as usual said, well, I don't think we're going to keep it at the base year level, which is a level 3. But supposing for the feedlot prevention, I want to increase that to maybe from 3 to 4. And so you can play around with these. You can also make them go down. And then down here for the these are the interventions for the key populations in terms of these 2 key parameters of interface, which is the contact between animal and human, and spillover, which is part of the contact, but it's basically the probability, and the way I think about it, it's not actually, that's not what the epidemiologist would call it, but it's basically the probability or the tendency to contract the disease if you're in contact with the animal. And interface, when you actually think about it, particularly if you're talking about a feedlot worker or somebody that works in an abattoir or a farmer, it's complicated because they're all in contact with animals, but does that mean they're in contact with them 24 hours a day, 7 days a week, 365 days, or is it 1 day a month? You know, if you ask them yes or no, do you have contact with animals? The answer is yes. But then what's the intensity of that? And also what's the nature of it? And that's partly what these interventions are about, is trying to simulate in a very broad brush way the parameters of that contact. And then, what are these? Oh, this is, at the end here, it's amplification. So what I'm going to do is I'm going to sort of go backwards in terms of what one would normally do. We've got in terms of key population, the herders, or and each one of these panels is a different population group, right? So there's those on the left. There's the herders. On the right is the slaughterhouse workers. And we've got consumers of animal products. So let me go in here for the consumers of animal products. And we've got the intervention both for prevention and detection and response at the maximum. I'm going to reduce them. To what they are in the base year. Oops, too far. Oh, come on. Oh, that one's already there. And then I'm going to go and look at the results. And reset it, but basically we're looking at, in the end here, about 95,000 people that are infected with brucellosis, and I think it was much lower than that in the original one. I didn't actually write it down, but I can go back and do that. So remember 95,000. Now we're going to jack these up. Yeah. And you can see it goes way down. It was 95,000 where we had no intervention, and with those interventions, it goes down to 18,000. So that's where we're modeling or simulating the effect of those interventions. Now you might ask, how do we know how effective those interventions are? And that's a very good question. And the answer is we probably don't. When we talk about effectiveness of interventions, whether it's in human public health or animal public health or this kind of one health disease work, you need research. You need evaluations. That's a lot of work. That's a lot of expenses. And in animal health, sure, in a laboratory or in a controlled environment, we know, vaccinations, their effectiveness for preventing the animal from contracting the disease. But the effectiveness of a vaccine given to one cow or one chicken is not the same as the effectiveness of a vaccine program at the national level, because it's just the same thing with children or vaccinations of children, because not everyone's going to get it. You're not going to vaccinate, in most cases, 100% of the flock or the herd, or your program may not be as effective in terms of the distribution of the vaccines and the uptake of it, or the cold chain may be violated at some point, and the vaccine may become less efficacious, effective. So we've built into the model some pretty broad assumptions that you can make. Basically, they reflect a guess as to if you increase, as those bars went up that you saw there, the tendency of those interventions to reduce the risk of whatever it is, transmission or the interface or whatever. So those are called elasticities in technical terms, but what they are.